The emergency room at Cedar Valley Medical Center was having another ordinary Tuesday night when everything changed in an instant. Emma Rodriguez had been working as a substitute nurse for 3 months, filling in wherever hospitals needed extra hands. She preferred it that way. No office politics, no complicated relationships with colleagues, just pure medical care when people needed it most. What she didn't expect was that her carefully guarded past would collide with her present in the most dramatic way possible. It started with a routine patient transfer. Emma was adjusting IV medications in room 12 when the trauma bay doors burst open. The paramedics wheeled in what looked like a standard motorcycle accident victim, but something felt wrong. The military-style boots, the tactical watch still strapped to his wrist, the way he carried himself even while unconscious on the stretcher. This wasn't just any patient. Dr. Kevin Walsh, the attending physician, barely glanced up from his chart. He'd been pulling double shifts for 2 weeks straight, and his exhaustion showed in every movement. "Room 4, he muttered to the paramedics. "Standard trauma protocol. Nurse Rodriguez, can you handle the initial assessment while I finish with the cardiac patient?" Emma nodded and followed the gurney into trauma room 4. But the moment she saw the patient's face clearly under the bright lights, her blood ran cold. Staff Sergeant Marcus Chen, Navy SEAL Team 6. She'd worked on him before, 3 years ago, in a field hospital in Syria. He'd taken shrapnel from an IED that had torn through his squad's convoy. She'd spent 6 hours keeping him alive while they waited for evacuation to a proper surgical facility. But Marcus wasn't supposed to recognize her. Emma had been Dr. Elena Martinez back then, not Emma Rodriguez, the substitute nurse. She'd left that life behind, for reasons she couldn't explain to anyone, especially not here in a civilian hospital, where her surgical credentials would raise questions she wasn't ready to answer. Marcus stirred on the table, his eyes fluttering open. The pain medication was wearing off, and she could see him trying to focus. His injuries looked severe, but not immediately life-threatening. Multiple lacerations, possible internal bleeding, definitely some broken ribs. Standard trauma work for someone with her background, but she was just a nurse now. She wasn't supposed to be making those assessments. "Where am I?" Marcus whispered, his voice hoarse. "Cedar Valley Medical Center," Emma replied, checking his vitals. "You were in an accident. Try not to move too much." His eyes sharpened as he looked at her face more carefully. She could see the recognition dawning, and her heart rate spiked. After 3 years of careful anonymity, her past was about to surface in the worst possible way. "Doc Martinez?" he said quietly, his voice filled with disbelief. "What are you doing here? I thought you were stationed at Walter Reed." Emma's hands froze on his pulse monitor. Around them, the trauma bay continued its controlled chaos, but she felt like everything had stopped. Dr. Walsh was still across the hall. The other nurses were busy with their patients, and nobody had heard Marcus use her old title. She had maybe 30 seconds before someone would notice something was wrong. "I think you're confused," she said carefully. "I'm Nurse Rodriguez. You've been in an accident, and you might have a concussion." But Marcus wasn't buying it. His training had taught him to read people, to remember faces and details that could save his life. Even injured and medicated, his mind was sharp. "Syria, October 15th, 3 years ago. IED blast took out our convoy. You spent 6 hours keeping me alive in that field hospital. You told me about your daughter back home. said she wanted to be a veterinarian. Emma felt the walls closing in. She'd never mentioned having a daughter to anyone at Cedar Valley. She'd been so careful to keep her two lives completely separate. But Marcus remembered everything, and now she was trapped between who she used to be and who she was pretending to be. "Sir, you're experiencing some disorientation," she tried again. "It's common with head injuries." Dr. Walsh appeared in the doorway, looking harried. "How's our motorcycle victim?" "Stable vitals, multiple lacerations, possible internal bleeding," Emma reported, falling back into her nurse persona. "He's been asking for pain medication." "Good. Set him up for a CT scan and get orthopedics down here to look at those ribs." Walsh was already turning to leave when Marcus spoke up. "Doctor, I need to speak with Dr. Martinez privately." Walsh paused, confused. "There's no Dr. Martinez on staff tonight. This is Nurse Rodriguez." Emma watched Marcus process this information. She could see him weighing his options, trying to understand why a surgeon he knew was working as a nurse under a different name. His eyes met hers, and she saw something that made her stomach drop. Trust. He trusted her completely, even though nothing about this situation made sense. "My mistake," Marcus said finally. "The pain medication must be stronger than I thought." But as Dr. Walsh left the room, Marcus grabbed Emma's wrist with surprising strength for someone who'd just been in a major accident. "Elena, what happened? Why are you here? Why are you pretending to be someone else?" Emma looked around the trauma bay, making sure they were alone. The weight of 3 years of secrets pressed down on her shoulders. She'd become Emma Rodriguez to escape the memories, the pressure, the impossible decisions that came with being a trauma surgeon in active combat zones. But Marcus deserved an explanation, especially since he'd kept her secret so far. "It's complicated," she whispered. "I left military medicine. I needed a fresh start." "But you're working as a nurse. Elena, you're one of the best trauma surgeons I've ever seen. Why would you—" "Because sometimes being the best isn't enough," she interrupted, her voice tight with emotion. "Sometimes you save 97 people and lose 3, and those 3 faces follow you home every night." Marcus studied her face, and she could see understanding dawn in his eyes. Combat veterans knew about guilt, about the weight of decisions made under impossible circumstances. He'd probably carried his own ghosts home from deployments. "The hospital in Kandahar," he said quietly. "The mortar attack that hit the children's ward." Emma's hands trembled as she adjusted his IV line. He remembered. Of course he remembered. The military medical community was small, and news traveled fast when things went wrong. The attack that had changed everything for her, that had made her question whether she could continue making life and death decisions. "I don't want to talk about Kandahar," she said firmly. "Fair enough. But Elena, what are you doing here? This is beneath your skill level." Before she could answer, alarms started going off. Marcus's blood pressure was dropping rapidly, and his skin was turning pale. Internal bleeding, worse than she'd initially assessed. He needed surgery immediately, and Dr. Walsh was still tied up with the cardiac patient. The nearest surgeon was at least 20 minutes away, and Marcus didn't have 20 minutes. Emma stared at the monitors, at Marcus's deteriorating vitals, and felt the familiar weight of an impossible decision settling on her shoulders. She could maintain her cover as Nurse Rodriguez and watch a good man die, or she could become Dr. Elena Martinez again and save his life. But if she revealed who she really was, everything she'd built over the past 3 years would crumble. Marcus's eyes found hers, and she saw the same trust that had sustained him through that 6-hour surgery in Syria. He believed in her abilities, even when she'd lost faith in herself. The monitors continued their urgent beeping, counting down the seconds until his condition became irreversible. Emma Rodriguez, the substitute nurse, would follow protocol and wait for help. But Dr. Elena Martinez knew exactly what needed to be done, and she was running out of time to decide which person she was going to be. The decision hit Emma like a physical blow. Marcus was dying, and she was the only person in this hospital who could save him. Not Nurse Rodriguez with her limited scope of practice, but Dr. Elena Martinez with her combat surgical training and 3 years of battlefield experience. She grabbed the emergency crash cart and started barking orders to the nearest nurse. "Get me 2 units of O-negative blood, stat. And page Dr. Walsh immediately. Tell him we need emergency surgical authorization." "Ma'am, I don't think nurses can order blood transfusions without—" "Just do it," Emma snapped, her voice carrying an authority that made the younger nurse jump into action. She was already calculating blood loss rates, assessing damage patterns, running through surgical options in her mind. The familiar rhythm of emergency medicine took over, pushing aside 3 years of careful restraint. Marcus's eyes were starting to lose focus, but he managed a weak smile. "There she is. There's the doc who saved my life before." Emma ignored him, focusing on the monitors. His blood pressure was dropping faster now, and she could see the telltale signs of internal hemorrhaging that civilian staff might miss. This wasn't just internal bleeding from the accident. Something else was wrong, something that required surgical intervention immediately. Dr. Walsh burst through the doors, looking frazzled. "What's the emergency? The nurse said you needed surgical authorization, but—" "Doctor, this patient has massive internal bleeding," Emma interrupted. "He needs emergency surgery right now, or we're going to lose him." Walsh looked at the monitors, then back at Emma. "Nurse Rodriguez, I appreciate your concern, but I'll make the medical assessments here. These vitals don't indicate—" "Look at his abdominal distension," Emma said urgently. "Feel the rigidity in his lower quadrants. He's bleeding into his peritoneal cavity, and if we don't get him to surgery in the next 10 minutes, he'll go into hypovolemic shock." Dr. Walsh stared at her. Those weren't observations a nurse would typically make, and they definitely weren't assessments she should be confident enough to state so definitively. But when he looked at Marcus, he could see exactly what Emma was describing. "How do you know that?" Walsh asked slowly. Emma felt the walls closing in again. She'd revealed too much, used terminology, and made assessments that were far beyond her supposed nursing credentials. But Marcus was still dying, and explanations would have to wait. "Because I've seen this injury pattern before," she said simply. "Dr. Walsh, we don't have time for questions. This man needs emergency surgery." Marcus tried to sit up, his face pale with pain. "Doc, tell him. Tell him who you really are." Emma looked between Marcus and Dr. Walsh, weighing her options. 3 years of anonymity versus the life of a man who'd trusted her completely. There really wasn't a choice at all. "Dr. Walsh, my name is Dr. Elena Martinez. I'm a board-certified trauma surgeon with 3 years of combat medical experience. I've been working under an assumed identity for personal reasons, but right now, that doesn't matter. What matters is that this patient is going to die if we don't operate immediately." The trauma bay went dead silent. Even the ambient noise of the hospital seemed to fade as Dr. Walsh processed what she'd just told him. Emma could see the disbelief in his eyes, followed quickly by anger at being deceived, then confusion about how to handle the situation. "That's impossible," Walsh said finally. "Your credentials show nursing school, not medical school. I've seen your file." "The credentials are real, but they're not complete," Emma replied. "Dr. Walsh, I know this is confusing, but we can sort out the administrative issues later. Right now, I need to know if you'll authorize emergency surgery or if I need to transfer this patient to another facility." Marcus's condition was deteriorating rapidly. His skin was clammy, his breathing shallow, and the monitors were showing the cascade of symptoms that preceded complete cardiovascular collapse. Emma had seen this progression dozens of times in field hospitals, and she knew they had minutes, not hours. "Even if what you're saying is true," Walsh said, "I can't authorize you to perform surgery. You're not credentialed at this hospital. The liability issues alone." "Then you do it," Emma interrupted. "But you need to do it now, and you need to follow my guidance. This isn't a standard trauma case. The bleeding pattern suggests a specific type of vascular injury that requires—" "I don't take surgical guidance from nurses," Walsh snapped, his exhaustion and confusion making him defensive. Marcus grabbed Emma's hand with surprising strength. "Elena, forget the politics. Just save my life." Emma looked at his pale face, then at Dr. Walsh's uncertain expression, then at the monitors showing a man running out of time. She'd spent 3 years hiding from the weight of surgical decisions, but some responsibilities couldn't be avoided forever. "Dr. Walsh, I'm going to ask you one more time to authorize emergency surgery. If you refuse, I'll have to transfer this patient, and he'll die during transport. If you agree, I can talk you through a procedure that will save his life." Walsh hesitated, looking between Emma and Marcus. The patient was clearly deteriorating, and despite his exhaustion, he was experienced enough to recognize that Emma's assessments had been accurate. Her knowledge of the injury pattern, her confidence in the diagnosis, even her command presence suggested medical training far beyond nursing school. "If I do this," Walsh said slowly, "and it goes wrong, both our careers are over." "If we don't do this, he dies," Emma replied simply. Marcus's blood pressure dropped another 10 points, and the monitors started their urgent warning sounds. Time had run out for discussions and deliberations. Emma could see the moment when Dr. Walsh made his decision, the same moment when she realized she was about to become Dr. Elena Martinez again, whether she was ready or not. "Prep O2 immediately," Walsh ordered the nursing staff, "and get me a full surgical team." Emma felt the familiar surge of adrenaline that came with emergency surgery. For 3 years, she'd suppressed the part of herself that thrived under this kind of pressure, that found purpose in impossible situations. But as she helped transfer Marcus to the surgical suite, she realized that some aspects of identity couldn't be buried forever. The operating room buzzed with controlled urgency as the surgical team assembled. Emma found herself automatically checking equipment, reviewing the patient's vitals, and mentally preparing for the procedure ahead. Her hands moved with practiced efficiency, muscle memory taking over despite 3 years away from surgical practice. Dr. Walsh scrubbed beside her, his movements tense with uncertainty. "Dr. Martinez, I need you to understand something. I'm the attending surgeon here, but I've never seen the specific injury pattern you described. I'm going to need you to guide me through this." Emma paused, her hands dripping with surgical soap. 3 years of hiding. 3 years of convincing herself she was done with this world. But Marcus lay on that table because he trusted her. And now Dr. Walsh was asking her to step back into the role she'd abandoned. "The bleeding is coming from a torn splenic artery," she said quietly. "It's a delayed rupture, probably from blunt force trauma during the accident. The initial impact created a small tear that's been slowly expanding. That's why his vitals were stable at first but deteriorated so rapidly." Walsh nodded, absorbing the information. "How do we approach it?" "Carefully. The spagubal, if we can control lean, is probably salve the bleeding quickly. But if we're too aggressive, we risk causing more damage." Emma's voice grew stronger as she spoke. This was familiar territory, the clinical decision-making that had once defined her entire identity. 3 hours later, Marcus was stable in recovery, his life saved by the steady hands of a surgeon who had almost forgotten who she really was. Emma stood in the hospital corridor, still wearing her surgical scrubs, watching the sunrise paint the walls golden. Dr. Walsh approached quietly, holding 2 cups of coffee and a folder containing paperwork she knew would change everything. She'd saved a Navy SEAL's life, but in doing so, she'd revealed the truth about herself. There was no going back to being just Emma Rodriguez, the quiet substitute nurse. Sometimes the greatest act of courage isn't charging into battle, but choosing to be who you're meant to be, when someone's life depends on it.